another such Hanuman to bring up one sort of Sanjeevani to get rid from this COVID problems. Incidentally, periodontal diseases also is a very uh, uncertain situations where we have got all sorts of microorganisms in the oral cavity, and that is leading to this sort of periodontal diseases. And as you know, it is affecting almost and every individual, and and it is supposed to be a most complicated condition so far, like COVID. Microorganisms and the host are constantly exchanging the warfare. You have got the host, you got the cytokines on one side, you got the microorganisms on the other side, who are playing a real warfare. In spite of modern advance, we have no specific organisms which is found in the periodontal pocket environment which causes the periodontal diseases. And similarly, no antibiotic therapy has solved this malady. Periodontal diseases is therefore an enigma. I think Dr. Snehashish, you are going to record it. Hello?
Yes, it's recording.
Yeah. The periodontal diseases affect vast population and is number 2 among the most common infections affecting the humans after common cold or the influenza, as said by the Guinness Book of World Records. In this challenge, man has hunted the microorganisms throughout over 3 centuries, right from the days of Sir G.V. Black to Listgarten to Sokransky and many stars in the galaxy, and still the hunt is going on. The microorganisms play a very important role in initiation and progression of periodontal diseases. Incidentally, there are 600 to 700 species of microorganisms that are dwelling in the oral cavity. Ever since the specific plaque hypothesis was described by Walter Losch, and also the modification from Koch postulates by Sokransky, there's a new world of microbial specificity that has dominated. The microorganisms like Porphyromonas gingivalis, Campylobacter, Actinomyces, now presently called as aggregator bacilli, and spirochetes have played an immense role in the microbial specificity. Now you can see these star-shaped organisms, which is supposed to be the Actinobacillus. These are Porphyromonas gingivalis, and here you see the spirochetes in different ways, and that's how situations are coming up. You've got different types of complexes which are found in the periodontal pocket environment, and the most dangerous ones are the red complex that is found here. This is comprising of gingivalis and Bacteroides, Bursitis, Telenera, lentifolia, and all these organisms which play a dominant role in bringing about the periodontal diseases. The present lecture will deal with the current concepts of microbial specificity, the modalities of host response, especially the interleukin 1 beta, prostaglandins, interleukin 6, and immunoglobulin levels in serum and clavicular fluid in response to Campylobacter rectus, Porphyromonas gingivalis, Actinomyces, Actinomyces concomitants to provide strong support to the microbial specificity. Incidentally, today interleukin 6 has been of great importance because of cytokine storms. Just now I was speaking to you regarding the COVID, and naturally that also has an important role because because of poor oral hygiene, they say there is more predominance of these organisms and viruses also, which can gain an entry through the saliva, through the gingival fluid into the body, and that can bring about such a paralysis and the storm. A relatively small number of microorganisms have been consistently implicated as important in the periodontal diseases. As just now I was telling you, some of these ones which have been told. Specific specimens of microbial examination are obtained to determine the causative infectious organisms and possibly their susceptibility to antimicrobial drugs. When used appropriately, diagnostic microbiological tests can be helpful in screening to identify risk factors, the severity of the disease, and estimate the progression and prognosis, and assisting in selecting and giving the therapy and providing a particular antimicrobial drug. Now, there are different types of diagnostic aspects which in oral microbiology has been told, and there are current assays for detection of periodontal pathogens which have diverse origins. So I am going to deal briefly in these aspects to some extent. Now, the most important one today is the immunofluorescence microscopy and ELISA. The second group was originally developed for detection of periodontal pathogens and was modified for detection of the particular organisms. Examples of these tests include nucleic acid probe assays and polymerase reaction that is called PCR. BANA test is a procedure which is associated with the hydrolysis, enabling the detection of bacteria producing trypsin enzyme in Porphyromonas gingivalis. So some of these are the ones which I am going to tell you in little details in short way. Of course, phase contrast. I'm getting some sound, I don't know where the sound.
Yes.
Some disturbance.
One more window you have opened, sir?
No, it's closed. It's closed. Yeah. I don't know from where the sound is coming. Anyway, the important aspect that we would like to deal also today is the phase contrast and dark field microscopy. The phase contrast and dark field microscopy are used as a microbiological assay of dental plaque. These plaque samples are placed on microscope and examined for the size, shape, and motility of the individual bacteria, especially the spirochetes, and the tooth-associated plaque is characterized by a small number of mainly non-motile cocci periodontal diseases associated plaque characterized by large number of small, medium, large spirochetes and motile or curved roids which are motile in nature. Of course, this is the apparatus which is used for phase contrast microscopy. At the same time, you can see the spirochete, which is highly motile organism related to periodontal diseases. By comparing plaque samples over time, the microscopy can detect shifts in the morphology and the motility of the plaque flora found in periodontitis. The ability to detect such shifts has a clinical relevance. So incidentally, whenever we are trying to study the healing aspect or the healthy aspect, naturally these motile organisms should decrease in their population when we are seeing it under phase contrast microscopy or dark field microscopy. There are positive correlations between the microscopic determination of motile rods and clinical level of gingival inflammation, as well as in the microscopic counts of spirochetes and the clinical pocket depths. Therefore, the clinical efficacy can be determined or demonstrated by shifts from a disease, as I was telling you, from a disease to an associated healthy associated flora. The major shortcoming of either dark field or phase contrast microscopy for detection of pathogens is that the method can not discriminate individual bacterial species. It will tell in general. These techniques cannot determine whether the small rod microscopically visible in a patient plaque like Porphyromonas gingivalis or Actinomycetum bastum or any other rod-shaped bacteria. Therefore, although it is a gross shift in the plaque flora that occurs in the periodontal therapy and in motivating the patients to perform better oral hygiene, it fails short of microbiological methods of determining the particular species, as I was telling you, of the organisms. Of course, today, bacterial culture or microbial culture is the gold standard, which is better than any other, and it's validated. In microbial cultures, the patient plaque samples are dispersed by sonification or vortex mixing and distributed into various type of agar media and culture under aerobic or anaerobic conditions. Especially in anaerobic conditions, we use a mixture of hydrogen, nitrogen, and carbon dioxide in the ratio of 5:3:2, and it's pushed in a jar, especially the anaerobic jar, and is cultured for about 3 to 6 days, and you can find these organisms growing in the blood agar plates. The plates are then examined for suitable incubation periods and individual colonies cultured. These bacterial species or strains are identified by multiple tests, including colony counting or cellular morphology, gram staining, patterns of their colonization, then sugar fermentation test, biochemical test, and chromatographic, of course, GCLC analysis of metabolic acids and end products. The clinical laboratory report details both the type of bacterial species present in the plaque sample in the patient and relative proportion of their absolute numbers. The bacterial culture is capable of detecting the broadest spectrum of pathogens. Of course, you have got variety of ranges of these organisms which can be found. Not only does the bacterial culture permit recovery of the widest range of species, but it is the most better method and helps in antibiotic susceptibility and resistance information that is highly important in planning treatment for periodontal infections. Well, these are some of the organisms like Actinobacillus, and this is Porphyromonas gingivalis found under the microscopes. And of course, the immunoassays, immunologic assays for specific periodontal pathogens involves the use of monoclonal or polyclonal antibodies directed against specific bacterial antigens or microbial virulence factors and therefore react only with the target bacterial species, excluding the rest of the bacteria found in the microbial sample or the plaque sample. You've got immunofluorescence microscopy, where you have direct or indirect microscopy, which can be helpful in conjugating this fluorescence to the organism, and that will help in detection. Of course, I don't want to go into details of the immunofluorescence, the direct and indirect immunofluorescence, but they are very helpful in detecting the organisms. Latex agglutination. This is another immunological assay based on the binding of protein to latex. Latex beads are coated with specific antibody, and when these beads come in contact with the microbial cell surface antigens or antigen extracts, cross-linking occurs and agglutination or clumping is occurring, and then it is visible within 2 to 5 minutes. And this is one of the better ways of detecting this particular test. This can be done by two ways. One is by direct assay or another by inhibition assay. In the indirect assay, it is the most common latex agglutination test is for bacteria. The antibody is bound to the latex when a suspension of plaque sample is mixed with sensitized latex, and then you will find in 3 to 5 minutes there is agglutination seen, and that could be one of the ways of studying the organisms. ELISA is another method which can be used for detection of particular organisms, and enzymatically you'll find there's a derived color reaction substituted as a label in place of radioisotope. This ELISA can detect antigens or antibodies also. Antigens are incubated in wells in plastic plates, and they are allowed to, after washing, to remove the free antigen, and sample containing suspected antigens are incubated with known antibodies to bind to the antigen on the surface of the well. And this is how you will find that there is a reaction taking place, and you will be able to find that particular antigen antibody reaction which leads to this particular conditions. There's another test which is called evalucyte. This is a number of enzyme linked ELISA using antibodies to detect antigens, especially for Porphyromonas gingivalis, Porphyromonas intermedius, and AA. The reactions are carried out in a simple chair-side reaction kit. Subgingival plaque samples are reacted with the antibodies and detection substrate in a multi-well reaction dish. And you will find that the membrane of bound antibody in the well specific to AA, PG, and PI react with the processed patient sample. And the antigen-antibody complexes formed on the membrane are detected by addition of an enzyme labeled second antibody together with a colored reaction or enzyme substrate. The separate dots indicate the presence of 3 different species, and the color intensity of the reaction indicates the relative number of bacteria. You've got also the probe, especially the DNA probe analysis or RNA probe analysis. Nucleic acids probes can be used to determine the complementary nucleic acids as sequences in specific bacteria. These probes can be in the form of DNA, RNA, or synthetic oligonucleotides. The use of bacteria specific DNA fragments via DNA or DNA hybridization technology to detect specific organisms has become a subject of great interest and has progressed from research technique to a practical clinical laboratory assay. Now, this DNA probe identifies species specific sequences of nucleic acids that make up DNA, thereby permitting identification of organisms. The technique is based on the concept that DNA is a double helix consisting of two complementary strands of base pairs. And naturally, when the double strand is split, naturally separation of these base pairs occurs, and a free nature, they bind again. So this is how the procedure takes place, and you will find that separation takes place, and you will be able to find out the base pairs. To prepare the probe, the specific pathogens are used, especially the marker organisms are lysed to remove their DNA. Then the double helix is denatured, creating single strands, and they are individually labeled with a radioisotope. And naturally, the plaque samples are collected on a sterile paper points or dental curettes and enzymatically digested, yielding single-stranded denatured DNA fragments, which are then exposed to complementary labeled probes and allowed to hybridize, and that will lead to the detection of these pathogens. Now, this is supposed to be a very quick and better way of detection. The DNA method includes probes for AA, PG, as I was telling you, even for Echinella corrodens and Fusobacterium nucleatum and Tannerella brenticola. The sensitivity and the specificity of these tests have proved optimal, as the tests are not affected by the presence of unrelated bacteria in the mixed culture samples. There's yet another test which is called as Omnigen. Omnigen, which is described, manufactured by Biotechnica Diagnostics Incorporated. Now, these DNA probe systems for a number of specific subgingival microorganisms. A paper point sample of subgingival plaque is placed in the container provided and mailed off to the company for the assay. And probes are available for several organisms like AA, P. gingivalis, P. intermedius, P. E. corrodens, and then also P. denticola and Bacterianorum. This PST, which is supposed to be again a sensitive test, which is placed, which is a very important one, and this is the only test to reveal a specific genetic marker that identifies the individuals at a high risk of severe periodontitis. A sample of the individual's DNA is collected from the fingerstick blood sample in a dentist's office, and this sample is then sent to medical sciences system, especially incorporated, and analyzed in a licensed genetic laboratory using advanced technology to determine if the individual is genotype positive or genotype negative. The individual evidence supports that when genotype positive individuals are bacterially challenged, they are at least 6 times more likely to develop severe generalized periodontitis, and they may therefore need to be managed even more aggressively to keep plaque levels under control. Of course, today we are familiar with this term restriction endonuclease analysis, and this method is of a microbial analysis is a primary tool that has been widely used in medicine and for identifying specific organisms. Restriction endonucleases are naturally occurring enzymes and that recognize and cleave the double-stranded DNA at specific base pair sequences. And you will find that these DNA fragments generated by the reaction with the enzymes can be separated by electrophoresis, stained with ethidium bromide, and visualized with ultraviolet light. The genetic heterogeneity and homogeneity of the bacterial strains can then be evaluated by comparing the electrophoretic patterns of the DNA fragments. These fragment patterns are specific to each strain and they are called as fingerprints. Now, restriction endonuclease analysis is a powerful tool in the epidemiologic research since it can determine the distribution and transmission of specific bacterial strains throughout the population. It is also very useful in studying the transmission pattern of putative pathogens that are found in the family members. The enzymatic assays especially are nowadays getting popular. Number of number of putative pathogens produce an enzyme called trypsin, and this trypsin-like enzyme can be hydrolyzing the beta-naphthalamide derivatives, mainly it's called as BANA, which is also known as N-alpha benzoyl DL-arginine naphthalamide. This BANA test, which is including for P. denticola, P. gingivalis, unspecified Capnocytophaga, and Borrelia bacteroides bursitis. This property has been exploited as a rapid way to detect the putative pathogens in the plaque samples. This BANA is a colorless, but upon hydrolysis, the beta-naphthalamide releases a color, especially with a number of dyes to form colored products. This BANA hydrolysis test that has been developed for chairside employs Evans black dye, which produces a permanent blue-black color when reacted with beta-naphthalamide. The test result is read by eye as positive, weak, positive, or negative. And the test is able to determine or identify the sites that harbor at least one of the BANA positive organisms. One of the potential difficulties with BANA test is that it may be positive at clinically healthy sites if BANA positive organisms are present in sufficient numbers. Now, this is the BANA kit. You can see the particular container, and you will find there are strips that are present which can be used for determining that. Yet another situation. Can be. I'm getting some disturbances. Please close down your speakers. Perioscan. Now, Perioscan is also a very important tool which was manufactured by Oral-B groups. Now, this is a chair-side test system which uses BANA test for bacterial trypsin-like proteases. Now, these are mainly produced by P. gingivalis, but lesser amounts are also produced by B. bursitis and T. denticola. The subgingival plaque sample is reacted in the kit with a substrate linked color to a color detection system. The system is particularly simple to use. The commercial firms owning these tests are constantly changing because some of them sell the rights of the products to others. For this reason, the firm cited as owning the test.
Sorry, sir, I am interrupting once. The meeting will time out in less than 1 minute. I request all the participants to rejoin using the same link once again.
Yes, please, And the last but not the least, the PCR reactions. The PCR reactions is relatively new nucleic acid based assay, which recently was developed by Carrie Mullis, the Nobel Prize winner. It can detect single microorganisms and has therefore the highest sensitivity of microbiologic method. It can also be helpful, which is supposed to be associated in different complex situations and is difficult to interpret. The specific bacteria and periodontal diseases has considerable information regarding even serum also. So you'll find that these antibodies which contained in the serum has shown to relatively increase in the presence of increased amount of pathogens that are associated with periodontal diseases. So investigators have found elevated serum antibody levels in conditions like AA infection or even localized juvenile periodontitis, in elevated antibody levels in Porphyromonas gingivalis and adult periodontitis also, and in situations like necrotizing ulcerative gingivitis with spirochetes. So you will find that the positive correlation among the specific bacteria elevated serum antibody titers, and specific clinical conditions, may be reasonable to use the antibody titers as an adjunct in the diagnosis of some periodontal diseases. Now, of course, today there is a new classification of periodontal disease which has emerged. And these periodontal diseases are classified based upon signs, symptoms, medical, and dental history. However, such classification does not give the pathobiological processes that are taking place as a result of microbial and host interaction. Now, there are several biologic systems that are acting, like bacterial infection, smoking, diabetes, which have a greater preponderance upon periodontal diseases also. In an award-winning study by the American Academy of Periodontology, Seattle, in 2008, late Offenbaker, of course, he is no more, he showed that several markers like microbial, inflammatory, and host responses assessment to characterize biologic phenotype in particular in patients. He studied a group of 180 subjects and with clinical signs, and he was able to segregate the clinical classification, which differs biologically but has common pathobiology leading to alveolar bone destruction. Thus, Offenbaker et al. Have come out with a brand new classification of periodontal diseases that correlated clinical symptoms and signs and biologic phenotyping of the microorganisms. For clinical parameters, 6,768 subjects were examined full mouth and evaluated for linear probing depth, especially the probing depth as we call the PD, the bleeding on probing, BOP, the gingival index, GI, and plaque index, PI, and cement-terminal junction. Now you will find that in some of these organisms, especially the part of the microbial study was conducted in 1,673 people. And they found that different types of organisms like PG, Treponema, and then Tentanella, Campylobacter, Prevotilla, Fusobacterium, all were studied on a checkerboard, chromosomal checkerboard, and was understood. The level of microorganisms was expressed as counts using microbial standards. The serum IgG level was also determined using immunocheckerboard using 7 organisms, as I was telling you earlier. And the level of IgG in nanograms per milliliter of IgG was studied. The clavicular fluid also was studied in 5,604 in the same group, and for PGE2, interleukin beta, 1 beta, and multiple cytokine reagents were used for 16 cytokines. All the study showed that the plaque organisms exposed to Campylobacter rectus in health, and there was an increase in GCF level, interleukin 1 beta, and PGE2. Whereas in the case of deep lesions, especially the deeper periodontal pockets and low bleeding index, you will find there's an increase in interleukin beta, 1 beta, and PG porphyrominus levels. And at the same time, you will find there's an increase in the IgG titers also. In case of deep gingival lesions, at moderate and severe bleeding, you will find that there was a higher level of interleukin 1 beta, interleukin 6, monocyte chemotactic factor peptide, and RANTES, which is also called as regulated upon activation in normal T cells as expressed and secreted. The study showed a molecular epidemiologic evidence that periodontal conditions reflects as an inflammatory response relative to the level of microbial burden with the respect of biofilm. In the conclusion, as I was telling you, the periodontists and the pathologists have been in a quest for a breakthrough in microbial aggression. Day is not far when this complex environment will be answered. Attempt to avert the onslaught and progression of periodontal disease will not only prevent tooth morbidity and also mortality, and also help the person to have a longer life as well. But the problems are the prolong of the lifespan of the individual also can be helpful by reducing the microbiemia or bacteremia. No wonder you will find that pathogenic organisms, they travel through the blood by bacteremia and cause different types of problems. and this atheromatous plaque formation, heart diseases, low birth weight babies, then heart attacks, arthritis, renal infection could all be answered through our periodontal colleagues and by microbiology. Thank you very much. So, hello? Hello?
Yes, sir.
Yeah, can you hear me?
Yes, sir.
Yeah, yeah. So, any questions from this regard? Please let me know. Yeah. Hello. Yeah. Yes, please.
Nita, madam.
I think I have stopped at exactly 1 hour 45 minutes time, probably by 7 o'clock. Yeah. Hello.
Yes, sir. I can hear you.
Yeah. So I think probably I have given in a nutshell how the inflammatory modulators, they are reacting to the microorganisms, and that is supposed to be a very important factor in causation of periodontal diseases. You will find that this breakdown of periodontal tissues is not only associated with microorganisms, but also the host also. You will find the immune response as a result of cellular immunity due to my inflammatory cells. At the same time, you'll find that there is presence of the host immune reaction, especially the humoral immunity also, where you will find presence of not only the histamine, the bradykinin, and all the things, but at the same time, you'll find the release of cytokines also, which are supposed to play a very important role. The same story takes place also even in COVID-19 infection. You'll find these organisms, these viruses, can bring about a storm that is taking place in the body, which is a release of interleukin 6 and interleukin 8 and all those things. And that can precipitate, huge amount of pathology that can take place, not only in the periodontal tissues, but also in the lungs. And that can bring about consolidation of lungs and pneumonia also, which is supposed to be the cause for death. So naturally, this is one of the portal of the entry of these viruses, especially the COVID-19. They have shown a relationship between oral hygiene and the COVID infection. So I'm told that if the oral hygiene is poor, if the interdental plaque or interproximal plaque or subgingival plaque is more, you'll find there is an elevation of these COVID organisms. At the same time, there's more chances of the cytokine storm that is taking place. So whatever I'm telling you is more associated with not just microorganisms, especially the bacteria, but also the viruses also. No doubt about it. All this complex environment that takes place shoots up in the blood. When you find there's an increase in the IgG levels, at the same time, you will find there is presence of the viruses also in the blood. This viruses will be secreted in the saliva also. So especially when we are doing dental treatment, especially we should be very careful to prevent the droplet infection. That's the whole story now today that's associated with COVID infection. And no doubt when we are doing work, when we are doing work in the clinics, we should be very careful to make use of all these gadgets and all those things to prevent the amount of droplet infection and the spread of these viruses. And saliva contains a damn amount of COVID-19 viruses. So I feel that we must be very careful, especially to prevent such pathologies that occur. Yes. This is the take-home message.
I think, yes, you have given a summary for this entire thing, and that has come out really well. I think over a period of time, I think we have to discuss more about the immunopathology, because clinically, yes, all this what you have told is relevant, and definitely your oral hygiene. That article has got published last week also. One very nice article, so I'll share that link to all the people, wherein it is periodontitis is a sign about the entire condition of the patient. that also it can predict the vulnerability to COVID infection, because as you told, microbes are involved and there is a lot of interleukin and all the biomarkers, cytokines, storm is happening. Periodontitis is the first, periodontal diseases is the first one where you indeed all of us read and correlate for the cytokine this. So therapeutically, how steroids have been used in periodontal disease, sir? There is a general phenomenon, wherein we tell steroids bring down the infection this. But in this COVID case, what's happening now? It is like more like immune mediated. It is like acting as if it's an autoimmune kind of disorder where there is a cytokine storm. So to balance that, they're giving steroids to the patients now, and some of them are coming with opportunistic bacterial infection after the usage of steroids, and others are dying of pneumonia because of this. And few, just in a fraction of 48 hours itself, the cytokine storm is going to such a level where there is a sudden demise. So you just opened the Pandora box. I think a lot of these aspects have to be.
One thing I'll tell you, the steroids are double-edged sword. That's what my professor used to say. On one side, it will help you. On the other side, it is going to kill you a lot also. Naturally, it suppresses the immunity. The lymphocyte count falls down like anything. So you will find more amount of mucormycosis or actomycosis, or it could it can even lead to osteomyelitis and all those things.
Correct. There are a lot of cases have been reported, the osteomyelitis.
So these are all the side effects of a sort of steroid therapy. But at the same time, steroids also play a very important role in reducing this cytokine storm. We should be very careful. We should also supplement the antibiotics at the same time. The steroids also together. It's not just one particular element that can solve the problem. In fact, we have to have a proper assessment of the conditions where we would like to know how we are going to solve this problem. But the balance is very necessary. Otherwise, a person who is suffering from a cytokine storm or even consolidation of lungs or pneumonia can even die in just, as you said, 24 hours or 48 hours.
Yes, sir.
That's going to be a very nasty situation. At the same time,
I would also like to ask you about how, I strongly feel like aggressive adult periodontitis is genetically linked, where there is, as usual, all the cytokines, everything is increased, and uncontrollable, irreparable damage will happen. So, any latest on that, sir?
See, as a matter of fact, adult periodontitis happens to a condition after 30 or 35 years of age. And it is commensurate with the local factors also, especially the calculus and plaque and all those things. So it is not much severe compared to the localized or generalized juvenile periodontitis. What is important is the quality of organisms differ in adult periodontitis and in juvenile periodontitis also. Whereas I was telling you about AA or Actinobacillus or Porphyromonas gingivalis, they are more predominant in conditions like juvenile periodontitis. Whereas the organisms like Actinomyces and all those things, Israeli and all those things, which are supposed to be producing more amount of calculus, they are supposed to be a little more subtle organisms compared to these nasty ones, as I was telling you. So naturally, good oral hygiene can reduce the breakdown further, at the same time can prolong the lifespan of the teeth, especially in adult periodontitis. Whereas in case of juvenile periodontitis, we have to supplement the patients with periodontal surgeries, at the same time antibiotic therapy, at the same time monitoring the patient quite frequently at the intervals of say 6 months or 4 months intervals. That will be very helpful post-surgically also. So that is very important. Yes.
So what about this molecular targeted therapy has it been implemented or used?
I still tell you, there is no specific organisms which are associated with periodontal disease. as I was telling you, there are 700 species of
So is it
organisms.
possible, like P. gingivalis for one, that it releases proteomics is in place right now? So anything where it can, a lot of research has been going on, but still we are not able to, coming up
all
with
a concoction and decoction. Let me tell you, the whole story is still in crossroads. Ultimately, we have still not been able to get a particular solution for this. So, as a matter of fact, monoclonal antibodies, as I was telling you, can only be done if you specify an organism. Here is a whole cocktail of 700 species.
ocean of
the nasty one. There, and even even in the red complex, you will see all these organisms which are present, which can be very
So one
nasty.
more thing, sir. Like in dental caries, we define it as a microbial disease, but we can't do the same for periodontitis. Any comments on that?
Yes, I will certainly agree to a larger extent. Here, you have not only the local factors that are playing a role, at the same time, you've got the systemic factors also, which dominates to a larger extent, especially conditions like diabetes, and hormonal changes, especially in women and all. So you will find such people where the hormonal changes are occurring, you will find there is a change in the tissue configuration also to a larger extent. The tissues become more red, more soft, more edematous, and you will find because of the estrogen deficiency, you will find that the tissues can become more inflamed, and it can bring about changes taking place, because of estrogen problems. Same way when insulin deficiency also in diabetes, you will find a variety of changes takes place. You will find the organisms will change the pattern of the microorganisms that are present in the plaque environment, in the pocket environment, definitely becomes more pathogenic, more gram-negative, more of anaerobic organisms, especially in diabetes. Same thing happens even in pregnancy also. You'll find the organisms are shifting more towards from the cocci to the bacilli type, though they are not deeply invading, but at the same time, the microbial flora variety of changes. It's not a normal pathogenic, normal flora, physiologic flora, but it is more and more advancing towards pathogenicity. So that's the whole cause. You have got two environments here. One is local and the systemic both, which are affecting the tissues.
Ma'am, I have a question. Ma'am, can remdesivir be substituted to any other economical and readily available steroids like dexamethasone? Is it an overhyped drug for symptomatic COVID patients?
Yes, Dr. Sneha, a very good question. Actually, I have been reading so much, and I don't know what will happen to me. Just now, I think before I had discussed with sir also, once the virus is incubated, in the incubation phase itself, they have to prescribe an antiviral drug, that is remdesivir. If the symptoms have started and if the patient is, in the 8th or 10th day, and which he has got this, all the prodromal symptoms are over, and there is an actual lung related problem, it doesn't work. It doesn't work. It doesn't kill the increased viral load. So I don't know, you're not there in that group. I have just posted about this remdesivir not, able to, you can stop the early infection, but you can't look for. So remdesivir is not the cure for a corona infected patient. It's mainly IV steroids and anti-clotting drugs. Because if you understand the pathogenesis, what's happening as the viral load is increasing, the cytokine storm is, it is autoimmune kind of reaction is happening. So the body is releasing cytokine, and it depends on individual to individual. Like only 1 out of 1,000 might, as of now, it is 1 per this in India, but in Bangladesh, I don't know. COVID negative are the ones who have to be more scared. They just don't have to, rely on the nasal swab report, because the PCR, the chain also has what the sequence
I think, Smita, you are getting some problems. Your audibility and the video is not working. Yeah. Hello?
Maybe, sir, network issue. Maybe a network issue.
Yes. So, incidentally, I think remdesivir is not the answer today. It's a fact also. Intimately, people are trying to chase some other organisms or antibiotics also, especially as I was telling you, clofazimab is supposed to be very, very useful, and especially it reduces the cytokine storm. It has been tried even in children, and even today's newspaper, it has come, even Times of India also, that people are in hunting for this particular drug, and very, very useful. That's what.
Sir, when to start with corticosteroids? Is oral corticosteroids are helpful like methylprednisolone?
See, it is when the patient comes to you, he is in a very, very nasty situation. He is suffocating. There is a very low saturation of oxygen. You will find the patient is gasping for breath. So you have to supplement the patient with intramuscular or intravenous steroid. At the same time, give oxygen. That is the only answer for it. You cannot just simply take remdesivir and solve the problem. Here is a situation where you have to pump in some amount of oxygen, especially, and at the same time, you should make sure that this storm reduces by using some of these steroids to some levels. Yes. Can you get me? Hello? Yeah.
Yes.
Yeah.
Yes. I think Smita ma'am's
connection
system is muted.
Yeah.
Yes, she's back.
Yes.
Some problem with your.
So my internet connection. I found too much of usage in Bangalore. Internet is fluctuating.
Yes. I know.
Yes.
So I think. Shall we call it a day now?
That was it. Yes, very interesting this. I think.
Thank you, Smita ma'am.
We will post this, Snehashish, and in next time I think we have to do a much more advanced, this, and also the link, because many have called and asked, they were not able to log in for whatever reason. I am not able to understand. I think 2 or 3 have messaged even in the messenger group. We'll sort this out. Okay. Thank you, sir.
Thank you very much.
Yeah.
And
Bangalore is in a.
Yeah. You please render the recording also, if possible, right? As far.
Sure, sir.
You can join both the old and the new, the second and the first part, both together, and then work it out. Okay.
Yes.
Sure, sir.
Thank you very much.
Thank you, one and all. Yes. Bye. Good day.